The primary assessment remains the same for a responsive person. Look for any immediately life-threatening problems. If it is safe to approach, do so. Introduce yourself. Let the person know you are first aid trained and able to help. Assess for any difficulty in breathing. Briefly scan the body for serious bleeding. If found, control it immediately. Look for obvious signs of shock. Check the face or tissue color. Tissue color indicates the amount of blood circulating below the skin. Normal tissue color is light pink. Paleness indicates blood loss or shock. A bluish color indicates a lack of oxygen. Depending on skin tone, it may be easier to check tissue color on the palms, fingernails, or inside the lip. Check skin temperature by touching the forehead with your bare wrist. Normal skin feels warm and dry. Cool, wet skin can be an indication of shock. If a life-threatening medical condition is found or suspected, immediately activate EMS and provide any indicated care.
Here, use this to put the glass in. I can help.
Okay.
Let me have a look. Okay, just put pressure on it. Please get me the first aid kit and call EMS.
Okay.
Bleeding occurs when blood vessels found throughout the body are damaged. Heavy bleeding is likely if a large blood vessel is involved. Arterial bleeding is bright red and will often spurt from a wound. It can be difficult to control due to the pressure created by the heart's contractions. If blood is dark red and flowing steadily, it is likely coming from a damaged vein. Clot-forming fibers naturally collect at a wound site to try and stop bleeding. But heavy bleeding can overwhelm this and prevent clotting from occurring. Bleeding reduces the amount of oxygen that can be delivered to the body. If heavy or uncontrolled, bleeding can quickly become life-threatening. Pressure applied directly to a bleeding site until bleeding stops is the standard method for controlling external bleeding. Activate EMS immediately for any heavy bleeding. Bleeding exposes you, the provider, to potentially infectious body fluids. Always use disposable gloves as a barrier to protect both you and the injured person. When gloves are not available, an improvised barrier, such as a plastic bag, can be used. Using a clean, absorbent pad for dressing, apply firm pressure with your fingers or palm directly on the point of bleeding. If a pad is not available, you can apply direct pressure with just your gloved hand. If blood soaks through the pad, apply another pad, leaving the initial pad in place. Reapply pressure. Once bleeding stops, maintain pressure. Bleeding may restart if pressure is released. A pressure bandage can be used to maintain ongoing pressure and free you to do other things. Wrap a roller gauze or elastic bandage firmly around the injury to hold the dressing in place. Wrap with enough pressure to take over bleeding control. Avoid wrapping the bandage so tightly that the skin beyond the bandage becomes cool to the touch, bluish, or numb. Make sure a finger can be slipped under the bandage once it's applied. Tourniquets utilize a simple binding method around a limb to stop blood flow. Commercially available tourniquets are ready to use and easier to use than improvised one. If direct pressure is unable to control bleeding on a limb, use a tourniquet. A compressing band is snugly placed around a limb a few inches above the open injury. A solid handle connected to the band is twisted to tighten the band until bleeding stops. The handle is secured in place to maintain the constriction. Improvised tourniquets using the same concept can be created with nearby materials, such as triangular bandages, and something solid to twist with.
Over here. There's more hurt down there.
Are you okay?
I'm fine, go.
A tourniquet can also be considered a primary step to control severe limb bleeding when it is clear direct pressure cannot be applied effectively, such as in a mass casualty event, a person with large or multiple injuries, a dangerous environment, or for an inaccessible wound. Training in the application of a tourniquet is critical for its effective use. When direct pressure is unable to control bleeding, and the injury is located where a tourniquet cannot be applied, a first aid provider may consider the use of a hemostatic dressing. A hemostatic dressing is a unique dressing impregnated with an agent that speeds up the clotting process. A hemostatic dressing is packed into an open wound and held in place with direct pressure or a pressure bandage. Pressure is maintained until bleeding has stopped. Training is essential to learn the proper application of a hemostatic dressing. Regardless of the type of bleeding or method used to control it, early and effective bleeding control is essential to protect life. Choking can occur when a solid object, such as a piece of food or a small object, enters a narrowed part of the airway and becomes stuck. On inhalation, the object can be drawn tighter into the airway and block air from entering the lungs. A forceful thrust beneath the ribs and up into the diaphragm can pressurize the air in the chest and pop an obstruction out of the airway. Compression of the chest over the breastbone can also create enough pressure to expel an object. To provide the appropriate care, you must first be able to recognize the difference between a mild blockage and a severe blockage. With a mild blockage, a person can speak, cough, or gag. This type of blockage is typically cleared naturally through forceful coughing. Allow someone with a mild blockage to try and resolve the problem on his own. Stay close and be ready to take action if things worsen.
Three-day weekend coming up. You have big plans?
Yeah, we're thinking about heading up the lake for a little R&R. Hey, Malcolm, what about you?
Johnny, what's wrong? Are you choking?
When a severe blockage occurs, a person cannot take in enough air to dislodge the object. Signs of severe obstruction include very little or no air exchange, the lack of sound, and the inability to speak or cough forcefully. A person without any air exchange requires your help to survive. The person may hold his hands to his throat while attempting to clear the obstruction. If you suspect someone is choking, ask, "Are you choking?" If the person nods yes, act quickly. Stand behind the person. Reach around and locate the person's navel with your finger. Make a fist with your other hand and place the thumb side against the abdomen just above your finger and below the ribs. Grasp your fist with the other hand. Give a quick inward and upward thrust. Each thrust needs to be given with the intent of expelling the object. Repeat thrusts until the person can breathe normally. If the person becomes unresponsive, carefully lower her to the ground. If not already done, activate EMS. Begin CPR, starting with compressions. Look in the mouth for an object after each set of 30 compressions before giving rescue breaths. Remove any object if seen. When someone is clearly pregnant or obese, use chest thrusts instead of abdominal thrusts. Position yourself directly behind the person. Reach under the armpits and place the thumb side of your fist on the center of the chest. Grasp your fist with the other hand and thrust straight backward. If you are choking and alone, try pressing your abdomen quickly against a rigid surface, such as falling onto the back of a chair. If one is not available, attempt abdominal thrusts on yourself.
Tia, Chuck needs your help. He fell off the ladder.
fell from really high up there. I could go get the first aid kit.
Yes.
Okay.
When the body suffers a significant force, such as from a high fall, serious injury can result, most notably to the spine. Injury to the spinal cord can result in temporary or permanent paralysis. Paralysis of chest muscles could result in the loss of breathing. Serious shock may also occur. Always make sure it is safe to provide care. If you suspect a spinal injury could have occurred, quickly tell the person to remain still.
Chuck, I can help. Just stay as still as you can.
Suspect a spinal injury when there are obvious injuries to the head, neck, or back, or there is numbness, tingling, burning, or a loss of sensation in the arms, hands, legs, or feet. Activate EMS.
Thanks. Can you call
The lack of
EMS?
symptoms or obvious injury does not mean that the spine is not injured. If a significant mechanism of injury occurred, it is best to assume a spinal injury exists. After an initial injury, the movement of damaged spinal bones can result in additional injury to the spinal cord or surrounding tissue.
Okay, Chuck. I'm going to help keep your head still until help gets here.
Prevent further injury by restricting spinal movement with manual stabilization of the head. To perform spinal motion restriction, get into a comfortable position behind the person. Cup your hands on both sides of the head to manually stabilize it. Minimize any motion of head, neck, and back. Establishing an airway for an unresponsive person is a higher priority than protecting a suspected injury to the spine. Tilt the head and lift the chin when necessary to maintain an open airway or give rescue breaths. When a head, neck, or back injury is suspected, it is best to leave the person in the position found. However, if the airway is threatened, quickly roll the person as needed to clear and protect it. If you need to leave an unresponsive person with a suspected spinal injury alone to get help, place the person in a recovery position to protect the airway before you go. Comfort, calm, and reassure the person. Reassess regularly until another provider or EMS take over.
Hey, I need some help out here. She fell.
Injury to the brain can occur from a significant blow to the head or by rapid movements of the head that force the brain to bounce around within the skull. Significant swelling or bleeding inside the skull can result in increased pressure that damages delicate brain tissue. Suspect serious brain injury when a blow to the head clearly results in a diminished level of responsiveness.
Call 911.
Surgical intervention may be the only treatment. Activate EMS without delay and manually stabilize the head with your hands. Do not attempt to stop the flow of blood or fluid from the ears or nose. If the person has a seizure, protect the head as much as possible and prevent her from bumping into nearby objects. Do not restrain the person tightly and do not place anything in her mouth. Seizures will generally last for just a few minutes. When the seizure stops, reassess regularly until EMS personnel take over. A concussion is a brain injury that generally results in less immediate or obvious signs. Most concussions are temporary and resolve naturally,
Hold on.
but it is possible for one to progress into a life-threatening condition.
Yeah, just give me a sec.
Suspect a concussion after a significant blow to the head or body when the affected person is unable to remember what happened just before or after the incident or recall simple facts about
Are we
it.
gonna do corner kicks?
That's what we're doing.
The person may move clumsily, answer questions slowly, or show a change in mood or personality. Additional signs include looking stunned or dazed, headache, nausea, dizziness, difficulty in balance, and visual problems.
Tell you what, let's go have a seat on the bench.
Here.
A first aid provider may be called upon to give advice on whether someone who may have a concussion is okay to return to normal activities. Unfortunately, there is no current concussion evaluation process for use by those trained in first aid. If you suspect a concussion may have occurred, the affected person should be evaluated by a healthcare provider or EMS personnel as soon as possible.
Because she was so unsteady and still confused after climbing with Emma, I'm concerned. She should be evaluated by a healthcare professional.
Okay, I'll take her to urgent care.
Because of the potential progressive nature of concussion, it is best to not allow the person to perform actions that could pose a risk for additional injury until she can be adequately assessed by a healthcare professional. Bones, muscles, and joints give the body shape, allow movement, and protect vital internal organs. Long bones form the upper and lower parts of each limb. Muscles, ligaments, and tendons attach to the bones, allowing for movement where the bones come together at joints. These bones are the most exposed to external forces and injury. There are 4 different types of injuries affecting bones, muscles, and joints. Strains are stretching or tearing injuries to muscles or tendons. Sprains are tearing injuries to ligaments that hold joints together. Dislocations are the separation of bone ends at a joint. And fractures are breaks in bones. Common signs of these types of injuries include swelling, pain, and discoloration.
I can help. Let's move you out here so nothing.
Distinguishing the exact type of injury is often difficult. It is best to treat everything as a possible fracture. The limb may appear deformed, and the person may guard it by holding it against his body. Unstable bones or joints can damage surrounding tissue. Encourage the person to not move or use the injured limb.
Just hold it as still as you possibly can.
If the injury seems serious or you are not sure, activate EMS.
To activate the emergency action plan and bring me the first aid kit, please.
Check to see if there is an open wound. Gently cut or tear away clothing to expose the injury site. Control any bleeding using a clean dressing and firm, continuous, direct pressure on the bleeding site. Do not push a bone back under the skin. Use padding in the gaps around it to provide a stable and comfortable spot for the limb to rest. If needed, place your hands above and below the injured area to help immobilize the limb. Local cooling can help decrease bleeding, swelling, and pain. It is best to not straighten an injured limb that is unnaturally angled. Leave the limb in the position found. If the limb becomes blue or extremely pale, circulation may be compromised by the injury. If you have not yet done so, activate EMS if this occurs. Splinting an injured limb can reduce pain and prevent further injury, especially when moving an injured person. In general, it is best to rely on EMS personnel to splint, as they have more extensive training, experience, and equipment. Comfort, calm, and reassure the person. Reassess the person and injury regularly until EMS personnel take over.
Hey Russell, how's the order for my burgers coming?
Pretty good. Just a couple more minutes.
Great, thank you.
Behind you. A little bit more.
A burn is an injury to skin and possibly underlying tissues caused by exposure to extreme heat, chemicals, or electrical contact. Common causes of thermal burns include direct contact with hot liquids, flames, or hot objects. Burns can also be caused by radiant heat from a hot environment or extended exposure to the sun. The severity of a burn is related to its depth and size. Deeper burns resulting in blistering or broken skin are more serious. Larger burns, even those with a shallow depth, are also more serious. Burn location contributes to severity. Burns involving the face, neck, hands, genitals, and feet can result in complications related to movement and other basic functions. Difficulty breathing as a result of inhaling hot air indicates a serious injury within the airway. All serious burns, or ones you are unsure about, should be evaluated by a healthcare provider. When a burn occurs, make sure the situation is safe for you to help. Act immediately to put the fire out. Direct a person to stop, drop, and roll. Smother the burning material with a coat, rug, or blanket. Or douse the material with water. Activate EMS if you think the burn is severe or you are unsure.
Can you call 911? Mike, get the first aid kit. I can help. Let's go cool this down some more.
Okay.
Carefully expose burned areas by removing clothing. If needed, cut or tear clothing away. If it is stuck to the burn, cut around it. Cool a burn with cool or cold water as quickly as possible. Cool the burn for at least 10 minutes. Use a clean, cool, or cold dressing as an alternative when water is not available. Never use ice or a frozen compress to cool a burn. There are also burn dressings pre-soaked with a specially formulated gel to promote cooling of the burn. Early cooling can reduce pain and minimize the risk and depth of burn injury. When cooling large burns, watch for signs of overcooling, such as shivering. Children have a larger surface area in relation to weight than adults and are more likely to have complications from overcooling. Remove any jewelry near the burned area. Separate fingers or toes with sterile dressings or pads. To improve healing, leave any blisters intact. Loosely cover the burn area with a dry, clean pad or clean sheet to help keep it clean and protected. Avoid natural burn remedies such as honey or potato peels. Never apply butter, ointment, lotion, or antiseptic to a serious burn. Give the person nothing to eat or drink. Keep the person calm and comfortable while awaiting EMS. Medical emergencies involving electricity can occur when there is direct contact with an energized object, such as an electrical wire or outlet, or when someone is struck by lightning.
Get us some help. May need the AED.
Be safe. If you cannot stop the flow of electricity, do not enter the area around the person or attempt to care for her. Turn off any electrical current before touching the person.
Off and locked out. It's okay to help now.
An electric shock can cause an abnormal heart rhythm in which the heart stops moving blood. When it is safe, perform CPR and use an AED if one is available. When a body part comes into contact with an exposed electrical source, electricity can travel from the point of contact to a second point of contact that is grounded. Common points of contact include the hands and feet. If the person affected is responsive and no longer in contact with the electrical source, look for burns at any suspected points of contact. Cool the burn as you would with a thermal burn. Cover with a clean, dry dressing. Consider seeking professional medical care because serious internal injuries can occur.
Oh, gosh. Great.
What happened?
Chemical spill, and it's starting to burn.
Some chemicals can damage skin tissue on contact.
Take it easy.
Get it in there.
The priority is to carefully and quickly remove the chemical to minimize any damage. While preventing any additional exposure to the injured person or yourself, immediately flood the affected area with large amounts of cool water, unless the chemical is known to react with water. Safely remove any contaminated clothing while continuing to flush the area. Flush with cool water for at least 20 minutes, or until the pain is relieved. Cover any visible burns loosely with a dry, clean pad and seek further medical attention. When dealing with dry chemicals, carefully brush off any dry powder with a gloved hand or cloth without creating further exposure prior to flushing. Corrosive chemicals splashed into an eye can quickly damage eye tissue. Affected eyes will become painful and appear red and watery.
Let me help, okay? We need to go rinse it out.
Immediately flood the eye with large amounts of water.
Wait your eye out. Wait your eye out. That's it. Keep your eye open.
Carefully hold the eye open and flush continuously for at least 15 minutes, or until EMS personnel take over. Flush outward from the nose side of the affected eye to prevent contamination of an unaffected eye. If the person is wearing contact lenses and they are not removed by the flushing, have the person try to remove them as flushing continues. If running water is not available, normal saline or another commercial eye irrigating solution can be used. Chemical burns to the eye require professional medical care.
Braden, call EMS.
Activate EMS as quickly as possible. Without interrupting care, contact the Poison Helpline at 1-800-222-1222 for treatment advice when a chemical burn occurs. If not available, talk to the EMS dispatcher or a medical provider.
Medical conditions and illnesses can suddenly trigger an unexpected medical emergency.
Good morning, Rick. How are you? Whoa, are you okay?
I don't know. All of a sudden, I just feel awful.
Okay, well, I can help. Is that okay? Tell me more about what...
In general, suspect a serious illness when, without warning, a person suddenly appears weak, ill, or in severe pain. In many cases, the human body displays warning signs to alert us to serious illness. The most common warning signs of serious illness are an altered mental status, breathing difficulty or shortness of breath, and pain, severe pressure, or discomfort in the chest.
Carl, are you okay? Let me help you, okay?
Caused by a number of medical conditions, as well as the use of alcohol, medications, or drugs, an altered mental status is a significant or unusual change in a person's personality, behavior, or consciousness. It is an indication of a change in brain function.
Carl, do you know what's going on?
Regardless of the cause, an altered mental status is a warning sign of a serious problem and is considered a medical emergency. Activate EMS.
Outside parking lot. I need EMS right away. And can you send somebody out with first aid kit?
Position the person for comfort. Calm and reassure him as best you can. If responsiveness becomes severely diminished, consider placing in a recovery position to protect the airway. Reassess regularly. The condition could deteriorate quickly and require additional care.
Hey, are you ready to get something to eat?
Yeah, I'm not having much luck with finding what I need.
Whoa.
Fainting is a momentary loss of consciousness caused by an unexpected drop in blood pressure and blood flow to the brain. Anxiety, fear, pain, stress, standing in place too long, or rapid movements in position, such as standing up quickly from a seated or lying position, can all result in someone feeling faint or fainting. A medication or underlying medical condition might also contribute to the cause. If someone complains of suddenly feeling warm, lightheaded, or that his or her vision is narrowing, quickly lie her flat on her back on the ground. You can elevate the feet about 6 to 12 inches, which allows blood from the legs to move back into the body. Do not elevate the feet if it causes pain or you suspect a person may be injured. This is a temporary condition that should pass quickly and allow the person to get back to normal activities.
A stroke, or brain attack, occurs when the blood supply to a portion of the brain is suddenly interrupted.
Somebody, we need help.
Sir? Madam? I'm Ellen and I work for the winery. Is something wrong?
I don't know what happened to him.
I can help.
A stroke most commonly occurs when a blood clot obstructs a blood vessel in the brain. A stroke can also occur when a weak spot in a blood vessel wall, known as an aneurysm, bursts open and bleeds into surrounding brain tissue. Signs of a stroke can vary depending on where the damage is located. The signs tend to show up suddenly. Numbness or weakness of the face, arm, or leg, especially on one side of the body. Confusion. A change in the ability to speak or understand. Changes in sight and balance. A severe, sudden headache. Early bystander recognition, along with rapid transport to a hospital, is critical for limiting damage or even survival. Medications are available at hospitals that can limit the severity of a stroke. The earlier they can be given, the better. A simple stroke assessment, such as FAST or FAST, helps decrease the time it takes to suspect a stroke, activate EMS, and get a person treated in a hospital.
Sir, can you try and do a few things for me?
F.
Okay.
Face droop.
Smile for me?
Ask the person to smile.
If you can.
Look to see if the smile is uneven.
Good. Now can you raise both of your arms?
A. Arm drift. Ask the person to raise both arms. Look to see if one drifts back down.
Can you tell me your name?
S. Speech difficulty. Ask the person to speak a simple sentence. Listen for slurring or difficulty. T.
I think we need
Time to activate EMS.
Troy, go call 911.
If the person has trouble with any of these tasks, activate EMS immediately. Report the time the person was last seen normal to EMS personnel. Overall, do not give anything to eat or drink. Be prepared for the possibility of sudden cardiac arrest and the need for CPR and the use of an AED. Stay close, calm, comfort, and reassure the person until another provider or EMS personnel take over. Diabetes is a disease in which the body cannot effectively use sugar for energy. Hypoglycemia, or low blood sugar, is a diabetic condition that can rapidly develop and become life-threatening. Early recognition and treatment by a first aid provider can prevent the condition from worsening.
Hey, are you okay?
No. I need to get started on this. I'm not sure how.
Suspect hypoglycemia with anyone who begins to act oddly or becomes confused. The person may be trembling or shaking, and his skin may be pale, cool, and sweaty. If the person is unable to communicate clearly, look for a medical alert bracelet or necklace, which may help identify the underlying condition. You can also check with others about the person's medical history or medications he may be taking. If someone is unresponsive, unable to follow simple commands, or has difficulty swallowing, quickly activate EMS and provide any required supportive care. Do not give anything to eat or drink.
Hey, Anna, can you come over here? Do you have your glucose with you?
My coat.
What's up?
I think Jerry's having a problem with his diabetes. Can you run to the break room and grab his coat? He has some sugar tablets in one of the pockets.
If the person is responsive and can swallow without difficulty, give about 15 to 20 grams of oral glucose tablets if they are available. If not available, use something with dietary sugar instead, such as orange juice, candy, fruit leather, or whole milk. Things that use artificial sweeteners will not help. It is important to note that insulin is not considered an emergency medication. It is never appropriate to administer insulin to a diabetic person in an emergency setting. Calm, comfort, and reassure the person. If he responds to the sugar, his mental status will gradually improve. If there is no response to sugar within 10 to 15 minutes, or the condition worsens, activate EMS and provide additional glucose or sugar. Reassess regularly until another provider or EMS personnel take over.
Eduardo?
Generalized seizures are triggered by excessive electrical activity within the brain.
Eduardo!
The result is uncontrolled muscle convulsions throughout the body.
Hey! Somebody help!
Typically, seizures happen without warning. Jerking movements of the body occur and breathing may seem absent. The person can lose control of his bowel or bladder and may vomit.
I can help.
While there are many things that can cause a seizure to occur, the care provided is always the same. Protect the person from injury during the seizure. Move objects away that he may bump into. Do not restrain the person. Allow the seizure to take its course. If possible, roll the person onto his side to allow saliva to drain from the mouth. Do not put anything in the mouth, including your finger. There is no danger of the tongue being swallowed.
Has he had a seizure before?
I don't think so.
Go call for EMS and get the first aid kit and AED from the break room.
Activate EMS if the person is injured or vomits during the seizure, has no history of seizure, has multiple seizures, or continues to seize for more than 5 minutes. Most seizures last only a short time and will stop without any special treatment. Once stopped, place the person in the recovery position to protect the airway. If responsiveness and breathing are absent after a seizure stops, begin CPR and use an AED if one is available. Normally, once a seizure stops, responsiveness improves slowly over time. Provide continual reassurance as the person improves. Provide privacy to minimize embarrassment. Continue to monitor until EMS personnel take over care or the person returns to normal.
Breathing difficulty or shortness of breath is a medical emergency. It is generally caused by an underlying medical illness such as asthma, allergic reaction, heart failure, or lung disease. At rest, normal breathing is regular and effortless. You may first suspect difficulty when there is a noticeable increase in the effort to breathe and the rate at which breaths are occurring. Coughing or unusual breathing sounds may occur.
Dale, what's wrong? Are you okay? Here, let me help. Come sit down.
A bluish-purple tissue color, especially in the lips or fingers, indicates a developing lack of oxygen and is a serious warning sign.
I think we should call for some help, okay?
Do not wait to see if a person's condition will improve. Activate EMS without delay.
Yes, I have a coworker here that's having a hard time catching his breath. Yes?
If an AED is available, have someone get it.
First aid kit and the AED, please.
Allow the person to find the most comfortable position in which to breathe. Loosen any tight clothing. Breathing difficulty can quickly become life-threatening as a person becomes exhausted from the breathing effort. Be prepared to provide CPR and attach an AED if breathing stops. Reassess regularly until another provider or EMS take over.
Adam? Are you okay? I can help. Okay? Is it your asthma?
Asthma is a medical condition in which certain things can trigger a physical reaction in the lungs and make it difficult for a person to breathe. In an asthma attack, the small airway in the lungs become narrow due to swelling and the production of mucus. Airflow into and out of the lungs becomes restricted. Asthma triggers include allergens such as pollen and molds, irritants such as smoke, fumes, and dust, medications such as aspirin or acetaminophen, extreme weather conditions, exercise, stress.
Do you have an inhaler?
Quick relief medications delivered with an inhaler device work fast to help control asthma symptoms. If the person has a prescribed inhaler for asthma, assist her in using it. Remove the cap on the mouthport and shake the inhaler well. Have the person sit up with her head back slightly. Holding the inhaler upright, instruct her to breathe out all the way and then place the mouthport of the inhaler between her teeth, sealing her lips around it. While breathing in slowly and deeply, have her press down once on the inhaler canister to release the medication. Have her remove the inhaler and hold her breath for at least 5 to 10 seconds to help the medicine get deep into the lungs. Repeat as directed by the dosage instructions on the medicine canister. A spacer is a device that can help deliver medication more effectively. Use one if it is available. Monitor the person for any changes in his condition. Activate EMS immediately if the symptoms seem serious, get worse, or if there is no response to the medication within 5 minutes.
A severe allergic reaction, known as anaphylaxis, is an extreme response to the body's immune system to something it is sensitive to.
I got stung.
Common things that can initiate a severe reaction include bee stings, peanuts, latex, and penicillin. When anaphylaxis occurs, the airway can become constricted due to swelling of the throat, making it difficult to breathe. Wheezing may be heard. Swelling of the lips, eyelids, and face may occur. Itchy raised lumps or hives can appear on the face and chest. The person may complain of nausea and abdominal cramping. A severe allergic reaction can develop rapidly. In general, the faster the reaction occurs, the more severe it is. Without treatment, death can occur within minutes. Activate EMS. Allow the person to find the most comfortable position in which to breathe. A person with a history of allergic reactions may carry a prescribed epinephrine autoinjector. Epinephrine can quickly reverse the effects of the reaction and may be life-saving. Autoinjectors use a spring-loaded needle to rapidly administer a measured single dose of epinephrine. They are easy to use with minimal training. If the person has an autoinjector available, assist him in using it on himself. If the person has not responded to an initial dose of epinephrine and EMS is still at least 5 to 10 minutes away, a second dose may be given. Reassess regularly until another provider or EMS personnel take over.
Acute coronary syndrome, or ACS, occurs when there is reduced blood flow to the tissues of the heart.
Oh man, you don't look so hot.
Often described as a heart attack, ACS is a serious condition that can result in significant damage to the heart.
I can help, okay?
Someone with ACS will generally experience pain, pressure, or discomfort in the chest. Women often do not experience chest discomfort and may describe indigestion, weakness, or fatigue. Shortness of breath, nausea, and lightheadedness can also occur. The person may experience pain in the arms or back. The person's skin may become cool, pale, and sweaty.
Jenna, can you come in here, please?
A person who has had previous heart problems is at risk for reoccurrence. Ask the person or any bystanders about prior problems or medications being taken.
Has this happened before?
Yeah.
Hey, listen, I think we should call for some help.
If you suspect a heart-related problem, do not try to transport the person to a hospital yourself. Activate EMS immediately.
Call EMS, tell them that we have someone
If an
with chest
AED
pain.
is available, have someone get it so that it's nearby if needed. Allow the person to find the most comfortable position in which to breathe. Loosen tight clothing. Calm, comfort, and reassure the person. A person who is having a heart attack may deny it. This is a common occurrence in this situation. Accept it, but never let this alter your approach to care. The early administration of aspirin can be life-saving for a person having a heart attack. While waiting for EMS providers to arrive, encourage the person to chew and swallow 1 adult 325 milligrams or 2 to 4 low-dose 81 milligrams baby aspirin. Do not encourage aspirin use if the person has an allergy to aspirin, evidence of a stroke, a recent bleeding problem, the pain does not appear to be related to the heart, or if you are uncertain or uncomfortable with giving the aspirin. Someone with a heart condition may carry a prescribed medication known as nitroglycerin. If so, assist the person in taking it. Whenever a heart attack is suspected, be prepared for the possibility of sudden cardiac arrest and the need for CPR and the use of an AED. Continue to reassure the person until another provider or EMS personnel take over.
Any substance that can enter the body and create a harmful reaction in the body can be described as a poison. By far, poisoning most often occurs by ingestion. Children under 6 years old account for over half of all poisonings. Common ingested poisons include prescribed medications, personal care products, and household cleaning products.
Hi, are you ready to go down to the dining room for lunch? You don't look well. Are you okay?
The effects of ingested poisons are wide-ranging and often resemble those of common illnesses. Abdominal pain or cramping, nausea, and vomiting may occur. A person may have an altered mental status.
Did you take your medications this morning?
Yes, a while ago.
You left the wrong bottle open. Are you wearing your glasses?
Oh no.
If you suspect a person has ingested something poisonous, act quickly.
Oh, do you think I'm gonna be okay?
I don't know. Let's get some help.
Ida, is everything okay?
Ida may have taken the wrong medication this morning. She's not feeling well.
Okay, I can help.
We think this is what she may have taken by mistake.
I'm not supposed to mix that with my other medications.
Okay. I'm going to call the Poison Help Hotline to get more information on what we should do.
Yes, please.
Hi, I'm with Serenity Hills Retirement Center. We have a patient...
In the United States, calling the National Poison Helpline at 1-800-222-1222 automatically transfers you to a regional poison control center. Poison control centers can quickly provide information regarding the immediate treatment to exposure of any substance. Activate EMS if the person is displaying any serious signs or symptoms. You can help EMS providers at the Poison Control Center by clearly identifying the substance and providing details about the incident. Save any vomit, bottles, or containers for EMS. Do not administer anything by mouth for any poison ingestion, unless advised to do so by a Poison Control Center or EMS personnel. Keep the person still, calm, comfort, and reassure. Reassess the person regularly until another first aid provider or EMS personnel take over.
So I'm thinking we get started about 9 o'clock.
No. Okay.
Dale, is everything okay?
Inhaled poisoning occurs when a harmful substance is breathed in. Suspect inhaled poisoning whenever someone is working in an enclosed space and he is feeling ill.
Could be carbon monoxide. We need to get you...
Make sure it is safe for you to help. If you can do so without risk to yourself, immediately move the person to fresh air. Common inhaled poisons include carbon monoxide, natural gas, solvent fumes, and chemical vapors. A person may complain of a headache, nausea, dizziness, and difficulty breathing. An altered mental status can occur. Some poisons, such as natural gas, have a telltale odor. Other poisons, such as carbon monoxide, do not. Help the person to find a comfortable position.
John, call 911.
Activate EMS if the person is displaying any serious signs or symptoms. Call the National Poison Helpline at 1-800-222-1222 for additional directions on care. Help identify the substance and provide details about the incident. Reassess regularly until another first aid provider or EMS personnel take over.
Heat-related problems occur when a body's normal temperature-reducing mechanisms get overwhelmed and become inefficient or stop working.
Let's take a break. Let's go inside for a minute.
This is especially true during vigorous physical activity. When a person is exposed to warm, humid temperatures, internal body temperature begins to rise. Normally, the person reacts by sweating, which evaporates and pulls heat out and away from the body. Simply rehydrating someone suspected of being dehydrated due to physical exertion and sweating could prevent serious heat-related problems from developing. Drinking a carbohydrate electrolyte drink, such as a sports drink, works well to do this. Use water if a sports drink is not available. Heat exhaustion can occur as a combined result of a rising internal temperature and dehydration.
Hey, are you okay?
No, I'm not doing so good.
Signs include heavy sweating and pale, cool skin. The person can become nauseated and vomit. He may complain of a headache or dizziness and feel weak.
Let me help you, okay?
Yeah, all right.
Okay, let's get you out of here. You may be overheated.
All right.
Although it may not appear serious, treat heat exhaustion quickly. Without early recognition and treatment, it could progress to heat stroke, a life-threatening condition. Have the person stop any activity and move him to a cooler place. Loosen or remove excess clothing. Have the person lie down. If he is uninjured, consider raising his legs 6 to 12 inches. Do not elevate the legs if it causes pain or the person is injured. Spray water on or apply cool, wet cloths to the head and torso. Use a fan to increase the cooling effect. If the person is able to follow simple commands and swallow without trouble, encourage the person to drink fluids, preferably a carbohydrate and electrolyte sports drink. Use water if a sports drink is not available. Do not give anything to drink if shock is suspected, the person is confused, or he has difficulty in swallowing. In most cases, the person's condition will gradually get better. If the person does not improve or seems to get worse, activate EMS.
I called you to check on my neighbor, Mr. Ford. He usually comes to the door right away. I'm really worried about him in this heat.
Okay, I'll check him.
Heat stroke is a condition in which body temperature rises because the body's normal cooling systems are overwhelmed or simply shut down as a result of extended exposure to a hot environment.
Wait right here. Mr. Ford? Mr. Ford?
Heat stroke is a serious medical emergency and can quickly cause permanent damage to the brain.
Mr. Ford, I'm with the sheriff's office. I can help you, okay?
A person with heat stroke will be very warm, even hot to the touch. Heavy sweating could be present, but in many cases the skin can be red and completely dry. Typically, the person will be confused and could have trouble communicating. The person may become unresponsive and could experience a seizure. Activate EMS immediately. The most important action a first aid provider can take is to begin immediate cooling with the resources available. When possible, the best method for cooling is to immerse the person up to the chin in cold water. If immersion is not possible, spray or pour cold water on the person and fan him. Apply cold packs to the neck, groin, and armpits. Cover the person with a cold, wet sheet and continue fanning. Provide continuous cooling until EMS personnel take over care. With early recognition and effective cooling, most people suffering from heat stroke will survive. A cold or cool, wet environment can result in a lowering of internal body temperature. Hypothermia and frostbite are the most dangerous cold-related conditions.
Dispatch 749.
Go ahead, 749.
General check at Middles Boat Landing.
Copy, 749. General check at Middles.
Hi, I'm Richard with the Park Service. What's going on?
I don't think he's doing well. I'm worried about him.
Sir, what happened?
Slip.
Hypothermia, a generalized cooling of the body, occurs when the internal core body temperature has decreased to 95 degrees Fahrenheit or less. It can be a life-threatening condition. Look for early signs such as pale, cold skin, uncontrollable shivering, and loss of coordination. As hypothermia progresses, shivering may stop, breathing and heart rate slow down, body process can become impaired and may fail. Remove wet clothing and cover him with something dry and warm. Activate EMS. Cardiac arrest could occur. Get an AED if one is accessible. To care for the person, move him to a warmer place. Move him slowly and without rapid movements. Cover his head and neck to retain body heat. If you are far from professional medical care, begin actively re-warming the person. Place him near a heat source. Put containers of warm, but not hot, water in contact with the person's skin. It is best to recognize and treat hypothermia early. The chance for survival decreases as the condition progresses.